We'll be starting the local news live program in just a few minutes on AOC 1, which is Cox 15, and LUS 3, as well as Cypress Street Radio, aocinc.org/CS radio. All right. Good morning, everyone. Thanks for tuning in to our local news live program here on AOC 1. That's Cox 15, LUS 3, as well as Cypress Street Radio, aocinc.org/CS radio. We do this weekdays from 9 to 10, and normally we have volunteers in the studio to help us out, but we are practicing our social distancing, and staff will be leading this program to continue to provide this service for the community. We're going to have a lot of news this morning. We read from the Acadiana Advocate for the vision impaired, literacy impaired, or anyone who would like to have long form news in this way. Let me take these headphones off. Here we go. That's more comfortable. I'm Mandy Ayo. Today is March 18th. We have a lot of news to cover this morning, the majority of which has to do with the coronavirus and COVID-19, our local and state response. So let's go ahead and get started. Screening to begin in Lafayette. Drive-through tests offered at the Cajun Dome by Claire Taylor. Drive-through screening for the coronavirus will be available from 9 a.m. to 3 p.m. Wednesday at the Cajun Dome in Lafayette. Please do not show up if you're just curious. Jamie Angel, Communications Director for Lafayette Consolidated Government, said at a news conference Tuesday afternoon, "You won't be tested." No positive tests for coronavirus had been reported in Acadiana as of Tuesday afternoon. Some test results are pending. Across Louisiana, 196 positive tests were reported as of Tuesday, with 4 deaths. Testing at the Cajun Dome will be limited to those with symptoms of acute respiratory illness and at high risk of infection. High-risk people include adults over the age of 60, babies aged 10 weeks and younger, those living in communal environments, and those with health problems such as cancer, heart disease, HIV, diabetes. Pregnant women with acute respiratory illness symptoms are also eligible. The screening process, Angel said, is us trying to identify people that would need testing. Participants must have a photo ID and insurance card to be tested for the flu or coronavirus. Anyone without insurance must pay $50 for the tests, not the screening, he said. Medical professionals from Our Lady of Lourdes and Lafayette General Health System, along with Acadian Ambulance, will be on hand for the screening, which is not funded by LCG. Officials could not say how many coronavirus test kits will be available. Lafayette Parish Mayor President Josh Guillory said the screening site will be open as long as it's needed. A site in Broussard also is set up in case it is needed this week, he said. Stations will be set up outside the Cajun Dome to screen for the flu. If the flu is negative, the person may be tested for COVID-19. Motorists should enter the Cajun Dome grounds from Reinhardt Drive. Anyone not sure if they should be tested, Angel said, may call LCG's 311 line and press 1 to speak with a medical professional. The line will be active either Tuesday night or Wednesday morning. Once it's active, it will be staffed 24/7. Health professionals are needed to help with screening residents and working the 311 line. Anyone in the area willing to volunteer is asked to call 337-262-5311. I'll repeat that, 337-262-5311. Okay, just give me a moment. Let's follow on here. I'm making sure that we're not having any technical difficulties for our Cypress Street Radio listeners this morning. Okay, we're going to move on to our next article, Waiting to Exhale. Increased testing has some in Louisiana waiting up to a week for results, by Emily Woodruff. Private companies are ramping up their coronavirus testing, which means more Louisiana residents will soon know whether or not they've been infected with the quickly spreading disease. But as the number of tests has gone up, so have the wait times for results. Some patients say they are now waiting over a week to hear whether their test is positive, even after they've already had to wait days for approval just to get the test. Carol Pulitzer, a 73-year-old author and illustrator in New Orleans, said she visited the East Jefferson General Hospital emergency room on Saturday after coming down with symptoms and then trying to get the test from an urgent care clinic. Because she is considered at risk in her 70s and with existing health conditions, her severe shortness of breath and dry cough qualified her for the test, but she hasn't heard back and doesn't want to expose anyone in the meantime. Initially, at the emergency room, they told me it would be at most 72 hours. It's 5 days, said Pulitzer. At my age, I've decided to self-isolate. East Jefferson did not immediately respond to questions about testing turnaround. Another patient at a Lafayette doctor's office was told a test sent to a commercial testing lab will take between 3 and 7 days. Ochsner Baptist said in an email to healthcare providers on Tuesday that 64 patients are awaiting results at home and 18 hospitalized patients were under investigation at the 139-bed facility. Patients under investigation are typically awaiting tests. All COVID-19 results are taking longer than expected to return, the email said. Hospital executives pointed to national supply shortages at testing labs that are creating a backlog of tests as the reason for the delay in results. The kits require multiple parts, a certain size test tube to send the sample, the right size swabs made of a certain material, and a substance known as reagent required to test the sample. At different times, I think all of the different parts of the process have been in short supply, said Dr. Robert Hart, the Chief Medical Officer of Ochsner Health. Ochsner plans to roll out testing on site within a week, which executives said would allow for test results in 24 hours and much looser guidelines for testing. Right now, only very sick patients or those considered at risk, elderly or with pre-existing conditions, are being tested. As we bring testing in-house in the next week, testing in-house in the next week, let's see, I'm still having trouble connecting to our Cypress Street Radio. We're working on that. As we bring, as we bring testing in-house in the next week, I'm going to, apologies for the technical issues this morning. I'm disconnecting and reconnecting to our Cypress Street Radio program. I'm not seeing any audio levels coming through on it for some reason. So maybe having an issue here. We'll try it this way. Gotta love technology. It's really fancy. It's really fantastic. And it's helping us through a lot of things right now. By the way, we do have a blog post up on our website that we're updating to help you stay in touch while we're kind of staying apart right now. AOCinc.org. Okay, apologies. We're going to continue with this article about the testing services. As we bring testing in-house in the next week, that will allow us to open up and have a much more liberal policy, said Warner Thomas, the president and CEO of Ochsner Health. Executives did not outline what the new guidelines would be. In the meantime, some doctors and infectious disease experts said the lag in testing may be aiding in the spread of the virus in Louisiana parishes, as someone with a positive result is more likely to take steps to limit the spread of others. Inside hospitals, getting earlier results can also help reduce the need for protective gear, which is in short supply nationally. Every time a provider enters the room of a high-risk patient waiting on results, they should be donning gloves, a gown, eye protection, and an N95 mask, according to the Centers for Disease Control and Prevention. That gear needs to be removed before seeing another patient. If doctors know who is positive or negative for coronavirus, they can use the gear more selectively. Dr. John Heaton, the chief medical officer at LCMC Health, said the lengthy test process and sicker people have led to a backlog. The tests themselves take several hours to run, said Heaton. Some national reference labs have stopped taking samples for testing because their capacity is overwhelmed. It's also an increased number of people that are sick and who meet criteria for a test. At Tulane Medical Center, only patients who are sick enough to be hospitalized receive tests, but the hospital is still working on in-house testing capabilities, according to a spokesperson. The Louisiana Department of Health has had the capability to deliver results in 24 hours since it received test kits from the Centers for Disease Control and Prevention in early March, but the state has strict requirements for who qualifies for testing and a limited number of test kits. The samples also have to be couriered to Baton Rouge. In Baton Rouge, the 155 tests at Baton Rouge General's Mid-City drive-through test site ran out after 1 hour on Tuesday. Patients who went to a drive-through screening set up at West Jefferson Medical Center in Jefferson Parish were told they could expect results in 4 to 6 days. New Orleans is expecting an influx of testing kits as a member of a federal pilot testing program that will allow for broader and faster testing that is expected to roll out this week, Mayor LaToya Cantrell announced on Sunday. Gun and ammunition sales are up across Acadiana, by Dan Boudreau. Guns and ammunition sales have spiked in Acadiana and other areas around the country as the number of coronavirus cases continues to rise, retailers say. Some local retailers have reported a small to moderate size increase in sales over the past 2 weeks. At Lafayette Shooters, 3520 Ambassador Caffrey Parkway, sales of ammunition and accessories like mountable lights have increased, while at Cajun Concealed, 2811 Collie Saloom Road, sales have risen across the board, especially last weekend. I'd say it's safe to make the correlation between the coronavirus outbreak and increased sales, said Derek Parker, Director of Business Development at Cajun Conceal. Over the last few days, it's become more frenzied than in previous weeks, with people buying guns and ammo. I'll let the numbers speak for themselves, but I think people are scared. The trend is happening nationwide. According to the Los Angeles Times, sales picked up several weeks ago in states like Washington, where the first confirmed outbreak of coronavirus occurred, and in California, especially among Asian Americans who fear backlash stemming from fears of the virus. Between February 23rd and March 4th, the 11 days following a major outbreak of coronavirus in Italy, Louisiana-based online ammunition retailer Ammo.com has reported a 68% increase in sales compared with the 11-day period prior. Some brands and makes of ammo saw a 200% to 400% increase over that 11-day period. Stephanie Morin of Austin's Outdoors in Opelousas said she has noticed a marked increase in handgun and handgun ammunition sales in the past week. Sales are often up during tax season, but the bump due to coronavirus fears has gone beyond that usual increase. I'm expecting this week will probably be one of our busier weeks now that things and restrictions are being put into place, Morin said. Our ammo sales have definitely gone up, and our handgun sales have gone up as well. I think everyone's scared or trying to get prepared in case something happens, and people go a little crazy. Okay, moving on to the next article this morning. Let's see. Of course, our hospitality workers are bracing for an uncertain future. An article by Megan Wyatt. Although many servers went into work optimistic on Tuesday, their collective spirit had dampened within hours. They were already seeing a sharp decline in orders on day one of their new normal, which consists of plating meals in takeout boxes and delivering them to waiting customers in their cars to prevent community spread of the novel coronavirus in their dining rooms. It's weird being in the service industry and getting hit like this because nothing else is shutting down, said Josh Barber, a waiter and bartender at Charlie G's. Our lives are taking such a hard hit, but everything else feels the exact same. As he ran errands on Tuesday afternoon, Barber said he couldn't help but feel frustrated to see people filling up stores and other businesses while his restaurant's dining room was empty. Just the day before, Charlie G's had been crowded. Regular customers who don't normally visit on Monday dined in and tipped well. It made our day a little bit easier, Barber said. They came in and made sure we're okay, but overall, the mood was somber. It's going to be a difficult time, but we're going to survive together because We're a family. And I don't mean the management, I mean the wait staff. There's a camaraderie that comes when it's busy and you all hit the floor. We'll take care of each other going forward. Charlie G's normally has a handful of to-go or delivery orders on Friday and Saturday nights, but the restaurant is known for its service as much as its food. The restaurant plans to offer its full menu and regular dine-in specials in the coming days and weeks through to-go and delivery services, but Tuesday got off to a slow start. It's a big deal. The first day, Barber said, we're getting a better idea of it, it's even going to work, if it makes sense to stay open at all. We can't open an entire day for 2 to-go orders. Governor John Bel Edwards on Monday ordered bars to close completely and restaurants to close their dining rooms beginning on Tuesday until April 13th in an effort to prevent further spread of COVID-19. His statewide order allows restaurants to continue serving food through to-go orders and delivery services. Area waiters, bartenders, and others in the food service industry could each lose about $1,500 in wages if restaurants and bars stay closed for a month, according to an analysis by Jeff Daly of The Current. Many live paycheck to paycheck to begin with. Their average annual earnings of $18,000 in Lafayette Parish, according to the Bureau of Labor Statistics, falls short of the $21,000 survival budget for single adults, as calculated by the United Way of Acadiana. We're doing whatever we can to keep ours, said Amber Taylor, who has worked for 8 years as a waitress for Chris's Po' Boys. But we know there might be cutting back on schedules because we'll do whatever we need to do just to keep the doors open. Taylor, like others, said her biggest concern isn't losing hours or tips over the next few weeks. It's losing the entire restaurant and the co-workers she considers her family. She's worked at the restaurant since she was 16. When things were slower than they hoped Tuesday, she took a sign to the corner of Ambassador Caffrey Parkway and Robley Drive to let people know the Po' Boy shop was open and serving. In tragic moments like this, everybody tends to think of the worst-case scenario, Taylor said. I'm doing anything and everything to avoid thinking about the restaurant closing. It would change our lives forever. While some try to adjust to a new way of doing business, other restaurant owners haven't decided if they want to become to-go and delivery-only operations for the next month. Andrea Veron of Cafe Vermilionville is one of them. She said her staff has told her they would do anything to keep the restaurant going, even if it meant working without pay, which Veron said wouldn't happen. At the end of the day, I want a job to come back to, said Chloe Wright, one of her employees. If we're not making money and we're closed down, now's the time to do those honeydews we never had time for. What else am I going to do? Sit at home and watch Netflix all day? We're workers. We all are. We're used to the hustle. We're in the service industry. I don't think any of us are the type of people who want to sit back and watch our workplace implode. That's not what South Louisiana is. We're the kind of people who will come together and make it happen. Rural hospitals expect to see extreme demand by Ben Myers. Although Louisiana's rapid escalation of coronavirus cases remains concentrated in the New Orleans area, there are ramifications for rural hospitals as state officials plan for extreme demands on the healthcare system. As urban intensive care units fill up, for example, smaller hospitals may be called on to take people who need inpatient service but do not require life-saving care, said Jerry Phillips, executive director of the Rural Hospital Coalition of Louisiana. Meanwhile, if the new coronavirus fans out across the state as expected, hospitals in small towns and sparsely populated areas may need to transfer patients with severe symptoms to stretched-thin ICUs in cities. It's a balancing act for both urban and rural, Phillips said. Obviously, a hospital that is completely full won't be able to take additional patients. Phillips said staffing, equipment, and bed capacity are typically at fixed levels at rural hospitals, defined in state law as those with no more than 60 beds in cities and parishes of certain sizes. Some have small ICUs, some don't have any. Some have ventilators, which are critical in stabilizing patients with severe cases, and some do not. They are very much willing to help, but how much can they? Phillips said. If you don't have ICUs and ventilators, you can't treat this virus if you've got infections. A lot of them don't have those. Phillips said the Rural Hospital Coalition is working closely with state officials on plans for allocating resources, but said each individual hospital will determine what they can contribute. Many of the state's 50 rural hospitals are supported with local property taxes, which residents approved to ensure they have a nearby facility when emergencies arise. They need to make sure they have capacity for all needs. They wouldn't want to have overflow into their hospitals when the local community needs their support, Phillips said. The number of known cases in Louisiana stood at 196 on Tuesday evening, just 8 days after the state's first positive test result. State and local officials have since banned gatherings of more than 50 people, closed public schools, and ordered bars, restaurants, theaters, and gyms to temporarily shut down. The World Health Organization predicts that as many as 20% of those infected with the new coronavirus will need hospitalization, and Joseph Cantor, an assistant state health officer, said roughly 1/3 of hospitalized patients will need intensive care. Predicting the coming surge in demand for hospital services is difficult, Cantor said, because there is no reliable way to forecast the number of cases Louisiana might see, though officials in other states have done so. It just becomes very challenging when you try to model based on the information out there, which is an international experience and not directly relatable to us, Cantor said. Cantor said hospitals should shift resources and staff away from elective procedures and outpatient services to focus on acute care, adding that those able to add second beds in what are now single-bed rooms should do so. The state is not presently forcing such adjustments, but we are certainly discussing that, Cantor said. Such mandates, if they are issued, may be difficult for rural hospitals to meet. Larger hospitals, if they need to, they can close a floor down and move staffing around to accommodate the increase. What we have is what we have. We don't have additional personnel to pull from, said Cindy Juneau, Chief Nursing Officer at Avoyles Hospital in Marksville. Juneau said her hospital has 22 staffed beds, including 2 for intensive care. Additionally, the hospital has 5 ventilators, which Juneau said is unusual for a hospital of that size. There are 2,320 ventilators across the state, according to the Department of Health, putting it on par with the national per capita average, as illustrated in a February study by Johns Hopkins University. The study estimated there are 160,000 full-service and emergency ventilators in the United States. State health officials on Tuesday could not provide an estimate of the number of ventilators that will be needed. Projections are being worked out based on the restrictions that have been imposed, officials said. St. Martin Hospital, with 14 staffed beds in Breaux Bridge, has 3 ventilators available for emergency use, said Glenn Daly, the chief operating officer. The hospital has no ICU, Daly said, but a respiratory therapist and the nursing staff can tend to patients on ventilators while searching for transfer options. St. Martin Hospital is in the Lafayette General Health System, headquartered in neighboring Lafayette Parish. The hospital is already accustomed to receiving non-critical patients from Lafayette General Medical Center, the system's flagship hospital 11 miles away, Daly said. It will continue doing so as coronavirus-related demands increase, while serving the general population to the extent possible. If someone comes in, it doesn't matter what it is. If we have a bed available, we will take that patient, Daly said. The problem with us is we are limited to only 14 beds. Louisiana unemployment claims triple, workforce office speeding up payments, by Timothy Boone. Unemployment benefits are being sped up in Louisiana to the thousands of workers who have lost their job because of the coronavirus pandemic, and job search requirements are being waived temporarily. This is uncharted territory for all of us, Ava DeJoy, secretary of the Louisiana Workforce Commission, said Tuesday during a news conference. There are so many variables, and these are new, scary times. but together we will get through it. The commission has seen the number of people calling to file unemployment claims triple over its regular volume Monday and Tuesday. The sheer number of first-time filers has caused the website to crash a few times. The state has closed casinos, bars, gyms, and movie theaters to help contain the rapid spread of the coronavirus in Louisiana. Restaurants have been stripped of dine-in services and limited to takeout, delivery, or drive-through service. Separately, the state's tourism industry is being hit hard by temporary airline, cruise, and other travel shutdowns or restrictions. National retailers have started announcing temporary store closures. Between Monday and noon Tuesday, DeJoy said 3,600 people had called about first-time or continuing unemployment claims. In contrast, there were 1,698 initial unemployment claims for the week ending March 7th and 1,584 first-time claims for the similar week in 2019. Workers who are experiencing a temporary layoff or a reduction in hours are encouraged to apply for benefits because they may be eligible for unemployment, DeJoy said. If you have a reduction in hours, you're likely not eligible to get benefits, and it depends on the amount of hours you were getting in a week. Anyone who files an initial claim by Saturday and says they lost work because of the coronavirus will receive their first unemployment check in 3 to 5 days, DeJoy said. Normally, there is a 1-week waiting period, but claims are being reviewed immediately. The maximum weekly benefit is $247. The Workforce Commission Trust Fund is one of the strongest in the nation, with more than $1 billion in assets. DeJoy said even if no money was paid into the fund, the state could make unemployment payments to every displaced Louisiana worker for 17 months. We don't know how long this will last, but we are very proud that our fund has remained strong, she said. If a person lost their job because of the coronavirus this week, they have until 5 p.m. Saturday to file a claim. So people who are having difficulty with the website or placing calls have a few days. 25 new staff members have been placed to help handle the volume of phone calls, and hours have been extended from 8 a.m. to 7 p.m. The Claim Center's phone number is 877-783-5567. A button has been placed on the Workforce Commission website so people can leave their information. To file an initial claim, go to louisianaworks.net/hire. We're working with the Office of Technology Services to increase our capacity, DeJoy said. A business's experience rating, which uses the number of claims to determine how much a company pays in unemployment insurance, will not be affected by the coronavirus claims. COVID-19, coronavirus the latest. Amid virus, food stamp applications double in Louisiana. An article by Mark Ballard, Capitol Bureau editor. The number of people applying for food stamps roughly doubled Monday after a long weekend of increasing numbers of positive tests for the novel coronavirus and widespread shutdowns hoping to stem the spread of COVID-19, according to the State Department of Children and Family Services. Part of the reason may be some misinformation, but much of the cause of the dramatic uptick in applications for the government food program is because workers are preparing for a dip in their pay as businesses begin to slow down, said Sammy Guillory, Deputy Assistant Secretary, whose duties at DCFS include overseeing the Supplemental Nutrition Assistance Program. SNAP is the government program that helps buy food for nearly 770,000 individuals, or about 18% of Louisiana residents. As of Tuesday evening, Louisiana had 196 confirmed cases of the novel coronavirus, or COVID-19, and 4 deaths. Coronavirus cases have been confirmed in 13 parishes, though the cases are mainly centered in the New Orleans area. Governor John Bel Edwards said businesses across the state already have experienced significant economic losses due to the cancellation of events, loss of walk-in customers, depleted supplies, and other factors. The state has shut down K-12 public schools and has banned gatherings of 50 people or more, in line with recommendations from the U.S. Centers for Disease Control. Edwards ordered bars, casinos, gyms, and movie theaters to shut down for a month and for restaurants to curtail their operations to only offer delivery, takeout, or drive-through service. Guillory said he couldn't yet calculate just how many applications were submitted Monday, but individual staffers across the system reported handling twice as many new people applying for help than is normally the case, Guillory said. With this pandemic, we're getting a lot of people who have recently lost wages, Guillory said. We believe more people may be eligible for SNAP benefits due to many being off work during this time, and we want to make sure they know what food assistance is available and how they can apply, said DCFS Secretary Marquita Walters in a prepared statement. The application effort has been made more difficult by DCFS shutting down most face-to-face interactions to limit potential exposure. The agency closed the Orleans region offices and is transitioning to reduced workforce on site in other offices statewide. Working remotely, appointments are being conducted over the phone. Applications are available online or can be mailed. The good news is that services for most of our clients can be handled online, making it unnecessary to go to an office in most cases, including applying for benefits. The application process can be done without coming into an office, either by applying online or by mailing or faxing a paper application, Walters said. Those specifically looking for a SNAP application can text GET SNAP, no spaces, to 898-211. That's GET SNAP, no spaces, to 898-211. You can also visit dcfs.la.gov/GetSNAP. You can email LA Help You with the letter U, LA Help letter U .dcfs@la.gov, or you can also call 1-888-LA-HELP-U. That's 1-888-524-3578 between the hours of 7:30 a.m. and 6 p.m. Determining SNAP eligibility is a fairly complex process with many factors, such as shelter expenses, influencing sums that are then compared to federal brackets that determine who qualifies. But very generally, a family of four with an annual net income below $21,046 after being put through the formula can receive a maximum of $646 each month to help pay for groceries. SNAP benefits last for 12 months. There's this false idea out there that we've become accustomed to, is that anytime there's an emergency, there's going to be a DSNAP, said Catherine Heitman, spokeswoman for the department. The D is for disaster and basically abbreviates the eligibility process and subtracts losses caused by the disaster in the calculation, which means a lot of middle-class families who previously made too much money to qualify can receive food stamps for a month, sometimes two, while recovering from a hurricane, flood, or other natural disaster. But to start the DSNAP process, the Federal Emergency Management Agency first needs to make a declaration for individual assistance in affected parishes. FEMA has only done that 8 times for specific Louisiana parishes in the past 15 years. We think a lot of people are applying thinking there is going to be a DSNAP. That's not happening, Guillory said. We're telling them that since their circumstances have changed, they may very well now qualify for regular SNAP. Representative Higgins, Edwards' orders are out of line, by Sam Carlin and Bryn Stoll. After Governor John Bel Edwards ordered bars, casinos, and other businesses to shut down or curtail operations to fight the rapid spread of the coronavirus in Louisiana, U.S. Representative Clay Higgins posted a video in which he blasted the governor as out of line and accused him of sitting in an ivory tower. Higgins, a Republican from Port Barre, took a stance that is sharply at odds with public health professionals, political leaders, and President Donald Trump's administration, which has advised severe restrictions to tamp down on a rising tide of COVID-19 cases. Higgins posted the video titled, "We're Not Going to Take It Anymore," to his official congressional Facebook page on Monday. The people that own these businesses, they can make up their own mind. They're not stupid, Higgins said in the video as he walked in front of a strip mall. You can't make their decisions for them because you think you know best. They know how to limit contact and adjust their services to respond to this virus. It's a virus, man. We're not being invaded by the Chinese army. We're being impacted by a Chinese virus, okay? The Trump administration announced guidelines Monday that urged U.S. residents to stay home and avoid gatherings of more than 10 people, and called on people to avoid bars, restaurants, and other public businesses. Edwards had instituted many of those recommendations statewide in Louisiana by executive proclamation earlier in the day. Edwards' actions have mirrored moves by governors in numerous other states and have drawn support from leaders in both political parties. U.S. Senator Bill Cassidy, a Republican Louisiana, has been an outspoken backer of the measures implemented by Edwards and other governors. I lost my place. There we are. Higgins' video swiftly drew repudiation. Christina Stevens, a spokeswoman for the governor, called it incredibly disappointing that Higgins attacked the governor. Congressman Higgins clearly cares more about Facebook views than the people of Louisiana, Stevens said. In the span of about a week, Louisiana now has 4 deaths and 171 confirmed COVID-19 cases. We have one of the fastest per capita rates of coronavirus growth in the nation. In times like these, we need to come together to protect our people. Cassidy, a physician, called the governor's actions absolutely appropriate and said the only question is whether the measures will be enough to prevent a public health disaster from unfolding in the state. The catastrophic scenario is now playing out in Italy, Cassidy noted, with doctors forced to ration life-saving treatments. The death toll from the epidemic in Italy has been rapidly rising. Obviously, we're concerned about the impact on the economy, Cassidy said, but a situation like Italy crushes an economy, and it's going to be harder to get back up than if we take our hits now. U.S. Representative Cedric Richmond of Democrat New Orleans slammed Higgins over the post, adding that the steps taken by Edwards were smart and swift steps to keep our families and communities safe. The Facebook video posted by my colleague represents the larger sense of ignorance surrounding the coronavirus, and just like the virus, we cannot afford to let that spread, Richmond said. We are currently in the midst of a rapidly growing global pandemic, and it's opinions like that or like this that will ultimately keep people sick. Higgins' office didn't respond to questions and an interview request on Tuesday. Higgins' Monday night video isn't the first time the second-term congressman has ripped into major public health measures aimed at slowing the epidemic. Higgins blasted an earlier Edwards order banning gatherings of more than 250 people, criticizing the governor for including large church services in the ban. During a congressional hearing with a top official from the Federal Centers for Disease Control and Prevention last week, Higgins denounced any restrictions on travel or public gatherings in the U.S., proclaiming, "This is America." That night, Trump announced new restrictions on travel to and from most of Europe. Higgins also suggested the governor didn't have the authority to enforce the restrictions, a claim that was undercut Tuesday by several law enforcement agencies threatening license revocations or citations to businesses found in violation. You're hurting the citizens you're supposed to serve, and based on what statute? What are you going to charge someone with if they keep their business open? What statute? The governor's proclamation? Man, that's not a statute, Higgins said in the video. State Police, the Louisiana Sheriff's Association, the Louisiana Office of Alcohol and Tobacco Control, and other agencies noted state law gives the governor broad powers during a state of emergency, including the ability to restrict gatherings and limit business operations. UL and SLCC prep for online instruction. Transitions coming this week. Few calendar changes expected. An article by Ken Stickney. Faculty and students at the University of Louisiana at Lafayette and South Louisiana Community College plan to transition to online-only classes this week. UL spokesman Eric Marin said faculty members there spent Monday and Tuesday transitioning from in-class to online course delivery. He said those days were spent in both faculty planning and in uploading lessons. He said most professors would likely spend Wednesday explaining to students how the remainder of their courses would be completed. At SLCC, spokeswoman Christine Payton said all 9 campuses of the 2-year college will make a similar transition Thursday, although faculty and IT workers were still reviewing how to make some technical courses work online. For example, she said there are simulation models for some technical classes, but SLCC must make sure it will meet industry standards for some training courses. Marin said UL gave its students the option to remain on campus, although classes were being delivered online. 2 of 3 dining options remain open, takeout meals only on campus. No refunds are planned. Most students are staying on campus, Marin said. He said students generally stay in small groups and there are no on-campus events to lure a crowd. Also open on campus were residence halls, student health services, and the Edith Garland Dupre Library. At SLCC, no students remained on campus, and most faculty and staff were working from home. Payton said the college was only allowing 10 people at a time in the main building. The changes at both campuses were made to protect faculty, staff, and students from COVID-19, the disease caused by the coronavirus that has developed into a global pandemic. Campus officials said the campuses are mindful of national, state, and local directives for crowd sizes and social distancing mandates for people to stay apart to not permit the virus to spread. Plans call for UL and SLCC to keep to their semester calendars with graduations in May. Everything is still the same, Marin said. Payton said students can still contact campus offices, although employees are working from home. For example, she said, if prospective students want to contact an admissions counselor, they can still call the same campus numbers. Payton said registration for new students has been pushed back a week from March 23rd through 30th to prepare for online orientation. State education leaders seek waivers on tests by Will Sintel. State education leaders are asking Governor John Bel Edwards and federal officials to waive standardized testing and other rules amid the outbreak of the novel coronavirus. Part of the request was spelled out in a letter Monday to the governor by Sandy Holloway, president of the State Board of Elementary and Secondary Education, and House Education Committee Chairman Ray Garofalo, Republican of Chalmette. In the unprecedented times we face, we must afford our educators the most flexibility in the important work they do, the letter says. This will allow educators to move forward and focus their attention on keeping students and teachers healthy and safe. While Edwards has ordered public schools closed until April 13th, educators say they have been besieged with questions from parents and others about test requirements, including standardized exams that were scheduled for late March and early April. Holloway asked Edwards to waive statewide testing rules for the 2019-2020 school year, as well as annual teacher evaluations, which are based in part on test results. Other laws that would be shelved under the request include the minimum number of days teachers have to work in a school year, public school accountability assessments, charter school evaluations, tests for private schools that enroll voucher students, and Louisiana's mandatory attendance law. Edwards' proclamation, which he issued last Friday, waived the requirement that students attend schools a certain number of minutes during the school year, which means schools will not have to make up days lost by the coronavirus closings. Holloway and acting state superintendent of education Beth Sino are also submitting a waiver request to the U.S. Department of Education on 2920 state assessment and accountability requirements. The state plans to offer optional state assessments for schools and parents who want them. Holloway has already shelved annual school performance scores and letter grades, which are usually announced in the fall. This is allowed under a provision that takes effect when schools are closed for more than 18 days. Yearly letter grades are based in part on key tests that are expected to be canceled. Diploma requirements for graduating high school seniors, including minutes per course, has been set aside, as well as end-of-course exams for high school students and promotion rules for 4th and 8th graders. Officials who oversee the ACT, which measures college readiness, said national tests set for April 4th have been pushed back to June 13th. Students who were registered to take the exam next month will get an email in the next few days from officials of the group, which is based in Iowa City, Iowa. ACT is committed to making every effort to help those students impacted by this test date change, particularly those high school seniors who are facing deadlines for fall 2020 college admission. Martin Rorta, Chief Executive Officer of the ACT, said in a statement. More information is available at act.org. Cases poised to spike as more results come in, by Gordon Russell and Andrea Gallo. The number of known coronavirus cases in Louisiana is poised to spike, but when it does, it won't necessarily signal an acceleration in the spread of the virus. It will simply mean we're doing a better job of counting the cases. Up until this point, testing for the COVID-19 virus has been extremely restricted, with Louisiana doctors constrained by the dearth of testing kits that can be run through the state's lab, where nearly all of the roughly 500 tests performed so far have been completed. But commercial testing has started to ramp up in earnest this week. By Tuesday, the state lab had handled just 457 tests. Between Monday and Tuesday, Baton Rouge General Hospital tested nearly 400 people for the coronavirus and then ran out of test kits. Other commercial test sites were launching around the state. Though the results for such private tests tend to take longer and delays were being reported all over the country, there will eventually be much greater numbers of tests, which means there will be far more positive results. Allie Neal, spokeswoman for the Department of Health, acknowledged Tuesday the state expects case counts to continue to increase considerably. Louisiana officials are tallying positive commercial tests, but they are not keeping track of how many are coming back negative. As of Monday, just 3 positive commercial tests have been counted in Louisiana, but with the explosion in private testing, that will change quickly. The key question is, what will the spike mean? The more testing you do, the more positive cases you are going to find, said Suzanne Strafe-Bourgeois, an associate professor at the LSU Health Sciences School of Public Health and an expert in pandemics. Because the testing, until now, has been restricted to the very sick, we've only seen the tip of the iceberg. We already know it's widespread, but we'll see a tremendous spike now that lots of people are getting tested. People keep talking about new numbers of cases, which is not right, said Rebecca Christopherson, an expert in infectious diseases and emerging viruses at the LSU School of Veterinary Medicine. It's new numbers of detected cases. Spikes in cases are going to happen, Christopherson said, both because Louisiana is in the early phase of the pandemic and because the capacity for testing is expanding rapidly. Isolating those variables is difficult, so understanding what the spike means, especially in the short run, will be nearly impossible. It may take weeks of testing before the patterns clarify. If there is an upside to the coming spike, Christopherson said it's that people watching the number of cases skyrocket may take this as another confirmation that these efforts at social distancing and hygiene need to be adhered to. State officials are likewise hoping that the growing number of cases will build support for social distancing. The governor's actions have put us in the position to best flatten the curve, but only if people comply, Neal said. Tad Dallas, a quantitative ecologist and assistant professor at LSU, said the delay between testing and getting results is one challenge of trying to estimate what the outbreak numbers will look like in the future. Baton Rouge, for example, only started testing about a week ago, and test results can take several days to come back. This inherent lag makes it enough to estimate the true burden of infection right now. Okay, we have probably a good 6 minutes left. Let's see what else we can get in. I'm going to scroll here and try to get the most important information for you. Dental practices are restricted to emergency care now. This is an article by Blake Patterson. The Louisiana Department of Health is ordering dental offices to provide only essential procedures for a 30-day period beginning March 18th to prevent the spread of the novel coronavirus, effectively shutting down dental practices statewide until April the 16th. The Louisiana State Board of Dentistry said dentists should not perform any work that is non-essential, meaning it can be delayed without running an undue risk of harm to the patient. The board left it up to individual practices to determine what qualifies as an essential procedure. For Dr. Margaret Patterson at Oak Family Dental in Metairie, essential procedures will be provided for patients experiencing pain or swelling. She noted that it's important that patients experiencing emergencies like an infection or badly chipped tooth reach out to their dentist for guidance and avoid overburdening hospitals. A number of clinics already began adjusting their practices after the American Dental Association recommended on Monday that dentists nationwide postpone elective procedures and focus primarily on emergency dental care for the next 3 weeks. The executive director of the Louisiana Dental Association, Ward Blackwell, said the group largely supports the measure, though he was disappointed that the state didn't consult with the group on the specifics of the order before it was announced. Dentists are among the highest risk for exposure to the coronavirus, according to an analysis of data maintained by the Department of Labor. They often work with air-powered equipment that flushes saliva and blood out of the mouth and into the air. We treat everybody like they have a disease, no matter the patient's age or disposition, said Dr. Jerome Smith, a dentist in Lafayette. That's because we work 6 inches from people's faces. The restrictions are likely to be financially devastating for dental practices, which often run on incredibly tight profit margins, said Dr. William Welch of Highland Dental Center in Baton Rouge. He likened dental offices to mini hospitals, expensive to operate given the staff, supplies, and overhead required. We're feeling the same pain that other businesses in the country are feeling, said Patterson. We're going to have to get together on this one. And here are some COVID-19 briefs from staff reports. Lafayette police buildings are closed to stem the spread of the novel coronavirus. The Lafayette Police Department on Tuesday began restricting some one-on-one interactions between police and the public. The lobbies of the main police station at 900 East University Avenue and the Precinct 4 building at 1820 Moss Street are closed to the public, Corporal Bridget Dugas said in a news release. The department is utilizing a priority dispatch protocol, Dugas said. Residents should call 911 for priority emergency calls, such as when a crime is in progress, even property crimes, or when a life is in danger. An officer will immediately respond, she said. For non-emergencies, such as when an assailant is no longer present or the crime already has taken place, residents should call 911, but an officer will handle the case over the phone, Dugas said. There are certainly instances that may still require on-scene investigation, and we will respond as necessary, she wrote. Residents will be asked to complete a report over the phone with an officer where a report number will be provided. They may instead utilize the department's online reporting system by visiting lpdcor.lafayette.gov/cor. Lafayette Police also will suspend non-criminal fingerprinting at its main station and will not provide police reports in person until further notice. Accident reports can be obtained by visiting Police Reports, lexis.com/search. You can call the records section at 337-291-8621 for options on how to obtain an initial report. Lafayette malls are cutting their hours as stores close. Dozens of national retailers, including Apple, Macy's, Victoria's Secret, and Foot Locker, are temporarily closing their stores for several weeks to deal with the coronavirus pandemic, and the Acadiana Mall said it has trimmed its hours from 11 a.m. to 7 p.m. Monday through Saturday and from noon to 6 p.m. on Sunday, mall officials said in a Facebook post Tuesday afternoon. It has also closed the food court and play area. Many of the retailers have opted to close. At Northgate Mall, most tenants are keeping the same hours. Foot Action has closed its store, but it's taking online orders, mall manager Lisa Champagne said. The Scott Boudin Festival has been postponed until September. The 8th annual Scott Boudin Festival been postponed till September 18th to 20th. Mayor Jan Scott Richard and the festival board announced the delay in a news release on Tuesday. The festival had been scheduled for April 17th through the 19th. We are about out of time for our news program today. Thanks for tuning in. Local News Live. We do this weekdays from 9 to 10. We'll see you back here tomorrow on AOC. Thank you.